So good afternoon, everyone. Good afternoon, all. So the most awaited time came, and yesterday you have people have did well. I think so because of the question paper which we have seen. So almost is moderate to easy question paper. Those who studied properly, yes. Those who have just studied maybe 30 or 35 days, you maybe have little difficulties because this is a real genuine question papers needed for the nurses, which is very important, basic plus moderate. So I think you may know about now you have people have almost 24 hours duration gap was there. So you assessed all the questions and answers, and you now decided what maybe you are cutoff and so and so, and whether you are able to crack prelims confidently, or maybe you came to the decision now. I did 20 marks negative, 25 marks negative. So I don't know whether I'll get or not. So you may be having this confusion. I'm sure everyone have this one. So still we have not given the session yesterday, as we know that you people are tired, and moreover sessions are yeah, once again, yes, good evening, good afternoon everyone once again. So question paper is moderate and easy. I think what we have seen till maximum questions we have collected, but part one, so maybe 40 to 50 questions. So which we got from memory based. So from our students who have written the exams. So the question paper, as I said, for the old students and as well as new students, those who studied. So if you have been entered into coaching and you will be studying for last maybe 6 months or 1 year only, this question paper is easy. If you are preparing by yourself, I think this is a little complicated question paper only. So practically, yes, practically it's very important. So ask more question, doubts, what all doubts you have, put in the chat box. So let us have the views, and let me also check it out what kind of doubts you have. Right. So as I said, 24 hours is over. So you are very clear about your this one answers. I know that, but still it is our responsibility to give the questions as well as this one. Yes, just a minute. Yeah. Once again, good evening for everyone. So let us go for the session. Spoke successfully those who have written well. What I said, Metier students, for last 6 months, whatever we discussed, only one, my side, being a medical, surgical, and fundamental faculty, only one question came out of this, that Muse criteria. Okay, Muse criteria is newly updated one. Remaining all, you people knows all the triads, whatever we discussed, and maybe AMPU, bag, parts, maybe the new question. So most of the questions we have discussed from the psychiatric side, and this one not for this one LMR or this one 35 days. So regular batch content, 35 days content, maximum contents only we have this. Only 20% questions are new, and maybe you may get a little tough, but remaining 60% questions are easy only. Okay, so those who have studied for last 6 months, they may be knowing, and moreover, if people are happy, I know that most of the people are very happy. Those who have written exam. From our side, from our student side, what I got of feedback. So let us see the good result after 1 week. Okay. Yes, some questions, maybe I think hardly 8 to 9 questions were, which is not we have taught. Remaining all out of 80, I checked all the questions. 70 questions are whatever we taught, and from that only. Okay, so I think you can't able to tell no for all students especially. Okay, so triad maybe LMR sessions. I've taken new sessions for you. So the triad of data and all last batch we have discussed. This batch in the LMR I have not discussed. I forget to discuss, but the question was there. But see, some of the questions which I said mostly COPD questions are compulsory. You get a question. So basic question they have given the basics, right? So there is no option B as per the student's question. 68-year-old man with history of COPD present increasing shortness of breath, drowsiness and confusion. ABG shows like increased 68 acidosis. And what type of respiratory failure in this? What is the best? See how we discussed. This is not a direct question. And you are very clear what I said in the LMR type 1 respiratory failure. I hope all our Metier students have given the right answer. Type 1 or type 2 respiratory failure. I think Metier students have given the right question. So type 1 respiratory failure is always comes under, type 2 is different, type 1 is different, right? Type 2 respiratory failure, you have COPD, we have asthma, we have emphysema, and you all know that hypercapnic respiratory failure, which we have discussed clearly in your even LMR, hypercapnic respiratory failure, right? Hypercapnic is more than CO2, maybe more than 50 to 55. This is the guidelines for the type 2 respiratory failure. Very simple question. But if you have been studying by yourself, it is not possible to write type 1, type 2 respiratory failure unless until someone has given you knowledge or you have studied some coaching. Otherwise, it's not possible to give type 1, type 2 unless until. So type 1 when this comes under ARDS and type 2 is because of hypercapnic respiratory failure, the PCO2 will be 50 to 55 and you can see that more than 60. So it's a type 2 respiratory failure. It's a direct question. Yes, for us, it's a direct question only. So what is a come-down triad? It's one of the direct question. Repeatedly, we given the test series. Many test series we have given this a triad of death. I think you have seen those who have attended the session. So directly, you may be giving the right answer. So what is the right answer? You all know that. Yes. So fourth option, you are telling acute respiratory failure. To make you confusion, they have given. So answer is type 2 respiratory failure. Okay. Okay, fine. So please, you should know all the question and answer since you are going to prepare for mains exam. Okay, so all the questions answer you have to be clarified very clearly. So memory based question yesterday maybe we have discussed only one question answer, only one question answer. But we need a proper at least answer. So we waited for 24 hours. So based on the student feedback, so we have collected the question. Trade-off death, coagulability will be there. Yes, acidosis will be there, and hypothermia will be there. So always one of the most repeated question in your competitive exam, which we already given the test series, the regular batch we have discussed. LMR also we have discussed, not this LMR. Okay. What is the recommended gap between insulin injections at different site? This is the pattern of question. Usually insulin injection different site on the just the I don't know exact terms what they've given, but the question is when you give insulin injections, we have seen in our regular batch, I taught you very clearly. Whenever most common site umbilicus we are giving, usually we give 2.5 inches, 2.5 centimeter away from the umbilicus, right? In the flank region, this area we can give. So that's the question. I think so. Whatever given from the student, what is the recommended gap between insulin injection site and different site? So it's a direct question if you are well aware of this, and moreover we are given in the content. Okay. So I said we have almost out of 80 questions, 70 questions are we thought, only 10 questions were new questions, right? So I think nearly 400 to 500 Metier students will crack the exam. I feel so because of seeing the question papers. So be fast, one of the famous question which we usually discuss, balance, eye opening, eyesight changes, and facial drooling, arm drifting, speech, slurring of speech, and it's a time. It's a direct question. There is no doubt. Quickly you can go for next question. And this also last day I was discussing day before yesterday about iron sublimation, where I said exactly I marked the area where the questions will come. The same question came. I think those who have given important to that area may be knowing when I'm taking the community session, I just marked especially this area where the question will come. The same question they have given pediatric and yes. So this is also one more important part of questions in your exam. Yes. So 3 week of old female, infant brought to emergency, history of forceful non-bilious vomiting. So non-bilious vomiting, and the key point when I will teach this ABG, I given the 5 scenarios. Indication based questions may come. Signs and symptoms based ABG balance will come. So I given the clue. The clue is metabolic alkalosis where the vomiting is there. So one clue which we have, that's a vomiting, as well as very clearly it's given that forceful vomiting, non-bilious projectile vomiting, which is your metabolic alkalosis. I think direct question. So hope you got the right answers. Yes. right? So metabolic alkalosis, direct questions. It's a very simple question. Okay, I don't know how many people have did a mistake. So even when I took the classes of fundamental, I told you whenever you get a scenarios, there will be one key points to rule out the answer. So vomiting is your key point here. Okay. So what all doubts you have, put in the chat box. So I'm watching the chat box. Let's see whether if you have more doubts. So I will also clarify. Okay. 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 Okay, then yes, it's a direct. Which of the following is not commonly used in rabbit sequence? So rabbit last day rabbit sequence intubation. So RSI is always important, which we have also discussed in this one liner. So we have discussed about all the questions. So basically, rabbit sequence intubation we use midas, we use succinyl choline, we use propofol, don't use diazepam. Okay, so those who are in the practical side. So they may be having a clear answer for this. Okay. So cancer patients receiving the chemotherapy and develops, yes, sorry, this is actually 2,500. Am I right? So patients going for leukopenia, decreased WBC. So for three options they have given. So what may be your exact answers which you may be giving in your exam? Those who have studied the oncology chapters, chemotherapy, when you are seeing the patients with leukopenia, so which are the following complications the nurse monitor for the most closely? Which are the complications? What was the question they've given? So what is the fourth options? Exactly what is the fourth options? So they've given complications, not a precautions. What are the measures prior to complication? Since the complication was there, so leukopenia is there. So we have to assess for occult blood and stool and urine. Their chance of getting yes. So what is the question here? Generally, there is two options. So whatever the students given the questions, if it is what is the nursing priority precautions you will take to restrict the visitors also? Yes, that's the first priority usually. See the question. So whatever the students given, complications, which are the following complications would the nurse monitor for the most closely? Which of the following precaution we have to take to avoid visitors? See the questions, what the question came. Because visitors is very important because we isolation precaution, reverse isolation we will take for the chemotherapy patients, neutropenic patients, where we have to be very clear in when you are having patient with immunocompromise in the clinical. So we usually give reverse isolation and all the healthcare workers, visitors should be restricted.
Sir,
Yes.
1 minute, sir. They told about that the platelet counts are reduced like that they added, sir.
That is what actually bleeding. If it bleeding comes, if only chemotherapy patients are there with neutropenic or leukopenia, then precaution there, then visitors is right answer. But if the patients are giving, they have given platelet count also.
Yes, sir. They didn't mention about WBC. They mentioning about platelets, sir.
Acha, they mentioned about platelet.
Yes, sir.
Oh,
Platelets,
this
sir.
is the platelet, 25,000
Yeah,
platelet.
yeah, platelets, sir. It's not
Oh,
WBC.
sorry. Then it's fine. Then the right answer. If it is platelet, then it may be, you see that actually, if the platelet is decreased, then it is your answer is check for occult blood and stool and urine. Okay. So what is the sign that indicates therapeutic effect of magnesium sulfate? Once again, direct question. One of the most repeated question in your competitive exam. I hope everyone has given the right question. It is very easier. What is the first sign when you go for a therapeutic effect with eclampsia sign? They're asking. DTR is one of the most important. I think what is the option they've given? They have not asked any earlier sign or late sign. Whether this is right answer, right question. Yes, faculty is there. Whether it's right question.
Yes, sir.
Any
Like this.
change?
No, sir.
Same.
Around like this only they asked, sir.
Okay. So respiratory rate increases about it won't come. Urine output is it won't come. Urine output is 1.5 ml per kg or is fine. Okay. So the sign they're asking therapeutic effect of indicates the therapeutic effect of magnesium sulfate in patient with eclampsia. So whether therapeutic effect of magnesium sulfate patients uh, with eclampsia or the question is The question is they're asking magnesium sulfate, if usually toxicity, if it is toxicity, it will get increase, magnesium sulfate. So what is the therapeutic effect of magnesium sulfate? 4 to 7. Am I right? What is the question, Manikandan? If you have any doubt, because if it is therapeutic effect, eclampsia patients, they given the treatment and then they are assessing the sign, therapeutic effect, reversible sign. Whether
Yes, sir.
patient,
Actually, in the question they are telling nursing officer giving the magnesium sulfate
okay,
and which indicates patient attained the therapeutic level of the drug, like that they ask, sir.
which indicates therapeutic level of drug. Okay,
Which indicates that patient attained the therapeutic level, like that they ask.
okay, 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 fine. So then out of 4 options, if the question is this, then option is right. Okay. So we have to check about the options, whether they're coming back with absent tender reflex, the tender reflex getting increased. So the therapeutic effect is achieved. Okay. In some situation, a venous blood will provide adequate information as compared to an ABG. VBG results will. Yes. What is the difference between ABG and VBG? As I said, the most important, those who attended my session, when you are monitoring the ABG, usually how you consider VBG. ABG, we consider SaO2 value should be more than 80% suspected. If it is less than 80, SaO2 value is less than 80%, then we go for venous blood. So oxygen values, oxygen levels are, I think you are right, given the right answer. Yes, oxygen level. Different oxygen level is very important. A basic question, how can we can differentiate the ABG? Those who attended my session, I think a Metier student, they have written very clearly because I given always this, when you check the ABG level, SaO2 level more than 85, 90, 80%. If it is more than in ABG, then it's a atrial blood. If it is less than that, it's venous blood. So the oxygen level will determine whether difference oxygen level will be the major difference between the ABG and VBG. Okay, so it's a very direct question. Those who are in the clinical and those who know about clinical important about the ABG. So pre-medication, medications are pre-filled needle and syringes units of certain types of injection most commonly. So what is the question? This medications are in pre-filled image-based question, pre-filled needle and syringe unit for certain types of injection. What does it mean? Whether image-based question.
No, sir. Like this only they ask.
Pre-filled needle and syringes, how to give?
Yes,
Or
sir.
what?
Like that they ask.
Most commonly for which pre-filled
Mm.
injections, pre-filled needle and syringes, mostly what we give, subcutaneous or ID or IM or IV. If it is like pre-filled needle and syringes, I want to check it out this, whether the question is right or wrong. Because in IM also we have pre-filled needle and syringe. We give IM injection also, even adrenaline also comes with pre-filled needle and syringes. Many IM injections also comes. So please check the question. What was the question? This is right or anything else added to be added? Medication are in pre-filled needle and syringes. You need for certain
Pre-filled,
types of
I think pre-filled medication like that they added, sir. Pre-filled
pre-filled medication.
medication and a needle are attached with the needle, like that they asked, sir, the question.
Okay. Though no images were there.
No images, sir.
Okay. So pre-filled, mostly pre-filled needle and this one, 2 injections which usually pre-filled it will come for subcutaneous. One is erythropoietin and filgrastim. Okay, but subcutaneous is option. But question I want to be very clear because we have pre-filled even IM also. Okay, so but here I'll just go for subcutaneous. Let us see the question. So subcutaneous also right answers. Let us see the questions once again and revise this one. Okay. So according to Rights of Person Disability Act 2016, what is the person benchmark disability? So what is a benchmark disability? Right of this is actually, if you know about psychiatric which you have studied, this kind of questions, it is up to your knowledge whether you studied. If you may be writing, otherwise you can skip for the negative marking. So I don't know how you people have given. So it's answer they've given directly. It's more than 70%. Okay. Yes. Diaphanous, yes, it's very D by H into Q. Direct question. Diphenhydramine avail 25 mg and available doses 50. This also I discussed last day. So how much you will give? So you all know that you have to divide very simple. 50 divided by this one 25. So you get 0.5. Okay. Sorry. What is the question here? Right is 0.5. 0.5. Yeah, 0.5 is right. It's a direct question. They've given either they're asking how you will calculate how much ml you will give. Okay. Yeah, it's a direct question. So 0.2, 0.5 given, 0.2 they've given. Money? What's the value they've given? 0.2 or 0.5 ml?
I think both they given, sir. Around with some similar differences only they given, sir.
No, whether 0.2 they've given?
I think it is not 0.2, sir. 0.5 only, sir.
You can see the chat box. My chat box is disabled. I don't know what students are discussing. I don't know why my chat box is disabled.
Yes, students are telling 0.5 only, sir. 0.5 ml like that. They are
0.5, no? Okay.
0.5 they are telling.
Okay, fine. Okay, 0.5. So you calculate directly with the formula. How you calculated?
Sir, each ml will give around 50 mg. So how much ml we have to give, like that the question will be, sir.
Acha.
So we'll divide it, and the answer will be around for 0.5 like that, sir.
So if diphenyl 20 mg and available dose is 50 mg, so 25. Okay. Okay. Because if you according to formula, if you go d by this available dose, if you see available dose is 50, desired dose is 25. Okay. Into quantity x, they're asking, right? One more value they have to be given there in that side to find out the x. X is a quantity, ml. Whether they added one more value, please check it. Otherwise, if you calculate this, it will come 1 by 2. Yes, fine. 0.5. Directly we're given. Okay, fine. So 0.5 is coming. Okay. 0.5 is the right answer. The best formula for 24 hours fluid calculation for burns patients. So once again, you get a direct question. Yes, Parkland formula usually everyone knows. It's a very simple question. So while attempting the put ET tube for the patient's visualization with the laryngoscope, the mouth is filled with bleeding and shows fractures of the facial bones. What is the next step action? Good question. Practical scenarios. So what do you do? I told for your in your previous regular batch when I taught you ATLS guidelines ABCD. So in our slide for regular batch and short term slides, this answer was there. Because when you have fractures, usually we give facial fraction. However, we have to go for cricothyrotomy. I don't know how many people have studied the slide. It is separately one slide is there. Indication of the cricothyrotomy, indication of tracheostomy. So if you see that slide, which I took the class on short-term batch, you can see the indication of the cricothyrotomy. Whenever the patient comes with facial fractures, we have to go with directly best action perform cricothyrotomy. Okay. Best action they're asking, that is what actually initial action they're not asking to put a section. So the question is, Mani, this is the best action or initial action? Best action, am I right?
Yes, sir. Like that only they asked.
If it is the best action, what students are replying?
Students are replying cricothyroidectomy only, sir. Option D.
Fine. So mostly Metier students are aware of this question. And one more, the nurse wants to take a urine sample from the catheters for cultures. What is the optimum area to collect? Optimum area to collect. So where do you collect the urine sample? That's a very good question. So it's everyone knows. I told you in your microbiology session, we have to put a needle aspiration here. So we have to go with the answer D. Okay. So always urine sample above the bifurcation. We have checked. We have seen in the fundamental session. So another the question paper பார்க்கும்போது fundamental message questions except that mu criteria, all the questions I taught you in your last 4 or 5 months during your 35 days session as well as in your regular batch. There is no, you can't able to know because I have proof of recording. I have proof of recording and I have proof of slides where we given the question. Except LMR, usually we discuss little deeper, but this time we discussed in LMR. So some of the question missed in the LMR. But regular batch and short term batch, easily I said how to take the sample. Don't take the sample from here, or don't take the sample by the Euro bag and from the port or something. So as per the AIIMS guidelines, we have to follow the needle aspiration from the D. So what is the answer they are giving? What answer they are giving?
D only they are mentioning, sir. Most people are mentioning D only.
Very good. So it's a direct question. Okay. This may be, if you are good in your amber bag, have you seen the amber bag? Then you can write the answer. They've given the parts as usual. Yes, it's a good question. One more practical question we added. So it's if you know that you can go for, this is the face mask, pop-up valve, right? Some approximately self-inflating bag is there. 7. This is the self. See, we have to correlate which you know. You know this is the face mask, right? You know this is a self-inflating bag. You know this is a reservoir. Based on that, also you can go for the option. Okay. So it's also interesting direct question. ECG, the short PR interval. I think நீங்க வந்து இது மட்டும் இல்லைன்னு சொல்ல முடியாது. I repeated nearly maybe last 6 months, maybe 50 times I repeated only short PR interval seen in Wolff-Parkinson-White syndrome. Yes or no? Only one condition where when I took ECG, usually I will give this prolonged PR interval. We have hyperkalemia, we have first degree block. Shortened PR interval is only seen in one condition, that is the WPW syndrome. What the answer, what the reply they are giving? Is there the reply they are giving or not?
Reply they are giving, sir. Actually, the YouTube session was slightly delayed. 1 second, 2 second delay was there. That's why they are
there will be some 6 to 10 seconds delay, sir.
Yes, sir. Some delay was there. So they're after some time only they are replying, sir.
After seeing the question paper, I was very happy. They know that, I think. Now the reply came.
Yes, sir. Now they are replying WPW and some replying B. Yes, sir. Now they are replying good.
So இல்லன்னு மட்டும் சொல்ல முடியாது. Students, I have the proof of recording, proof of slides we have. We have all the proof. Recording sessions are there. Okay, short PR interval. Whenever I take the classes ECG, direct question, key points are there. Okay, it's a Wolff-Parkinson-White syndrome.
And another one in question, they added a slanting QRS, like that they added.
Slanting QRS will be there.
Yes, sir. Slanting QRS also they added.
QRS, and that is a delta wave.
Delta wave, but instead of delta wave, they asked like slanting QRS.
Yeah, delta wave will be there. Shortened PR interval. Wolff-Parkinson-White syndrome is always very good because sinus node, from the sinus node, usually impulse go to AV node, but in the Wolff-Parkinson syndrome, impulse goes to the accessory pathway in the opposite side and goes towards the bundle office. That's a special finding. And even I given the slides. Okay, so shortened PR interval. No one is having confidence that you have studied, but still it's an important question. And this is the another ECG which we have added. Everyone knows is pulses alternates are there. Oppositely, pulses alternates are there. So what is the key point which we have discussed here? This is the ECG and this is the answer. Am I right? This is the first you should check about regular. This is a regular interval and there is a shortened RR interval. What is the answer for this? What they have given? SVT they have given the same ECG?
Not same ECG, sir, but I can't get the same ECG, but like this only they given, sir.
Whether it's regular rhythm, this is lead 2. Lead 2 ECG always you have to assess. This is regular rhythm, but there is a pulses alterance is there. Maybe constructive pericarditis option was that.
I think it is pericarditis, sir, but not this ECG they given. But
whether option they have any, if this was ECG, this not a SVT.
No, sir. This pulses alternance was not there in the exam ECG, sir. They asked about SVT.
SVT, no,
SVT
then
ECG.
fine. SVT, this is the regular ECG, SVT ECG, answer is SVT only. Heart rate, once again, very important. We have 2 formulas. I always tell for the Delhi students, those who attended in Delhi batch also, I took 2 hours session in cardio, 2 hours long, 6 to 7 questions were there. So I said there is a calculation of heart rate in the regular ECG, irregular ECG. This is a regular ECG. So you have 2 formula, 300 divided by number of R wave between between RR interval. Okay, number of large boxes between RR interval. Okay, so we have 2 boxes. Better if you want to go with other formula, 1500 divided by number of small boxes between RR interval. Okay, so this is very important between RR intervals. So number of small boxes between RR interval, you can see that 4, 5, 6, 7, 9, 10, 11. So approximately if we calculate 5
in exam it is around 10, sir. 10 to 11.
10. If you calculate, comes around 150. Answer, what is the answer? Yes, 150. So I told students this was a question 2018. They were asking after that, after a long time, this heart rate calculation they were asking. Next time they will be asking same heart rate calculation in the irregular ECG. I give the question now itself. Maybe they may ask you irregular ECG. Irregular ECG, calculate number of R wave, multiply into 10. That is your right answer. Suppose if this is the irregular ECG, I will calculate 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So I'll calculate 15 to 10. It's a 150. Because this is regular ECG. Irregular, what happened? You get many, this is a regular. You may get like this. So you can calculate same 1, 2, 3, 4, 5, 6, 7. So 7 into 10, I will calculate 70 is a heart rate. Since this is the regular ECG, so we have to multiply 1500 divided by number of small boxes or 300 divided by number of large boxes between R interval. One other important direct question. There is no option rational here. Is everyone? I hope everyone have written well. Are you following objects? Yes. What is the object name? This is a ventilator they are using, gastrostomy tube feeding, but those who are knowing, maybe they may be seen. So this is maybe, I don't know how many people have written. So feeding level, those who are in the GA department, they may be knowing. Okay. Once again, direct question. There is a key point here. So what is the key difference between which area they will insert tracheostomy? Most common is second and third, no? Why went for third and fourth? What is the answer? Money?
Sir, no, sir. Actually, mistakenly
There is
given the
anything,
answer. No. Actually, the same picture also they given, sir.
Acha, picture. Oh, based on picture they were asking.
The same picture they given, sir. That's why he went like that.
Okay. Okay, fine. So from the picture you are answering, then it's 3 and 4.
From picture they asked, sir. They didn't. I think they didn't ask about the
good question.
common.
This is very good question. Most common site is your second and 3, but from the picture they've given 4th and 3 included. 2 is free. So its answer is 3 and 4 only. Little complicated, but still overconfident. Those who have given overconfident answer without seeing the image, they may be giving 2 and 3. How many people have given overconfident answer? I don't know, but still, please check it your answers. Lumbar puncture penetration. Already the repeated question in your AIIMS exam. Last time they were asking about bone marrow lumbar. This question came last NORCET 6, I think. Okay, previous year questions, memory based questions were there. The penetration from starting from your skin, subcutaneous tissue, but this supraspinous ligament, infraspinous ligament. This is actually anatomy. If you are having deep knowledge, only we can write. I can also accept. So this maybe you may give this as a negative mark. If you don't know, don't go for the choice. But the answer is A, skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, epidural and dural. This is the doctor's point of view question. But as I said, there will be 10 questions which will be tough. No one can answer. No one can answer. Just for luck, you may have given A. Okay, unless until if you do the lumbar puncture only, we'll come to know. And if, anatomically, if you are strong, we know only subcutaneous, epidermis, dermis, and the layer. Okay, the inner part of the layer is very difficult. So based on the medicine point of view, answer is A. And better such a questions you have to go for the negative. Leave the question. That will be the good option. Okay. So bag and mask ventilation. So they given what is the special thing? This is a new learning. Many people have maybe C clamp technique only. C clamp technique na உங்களுக்கு வந்து clinical வந்து C clamp na something different. They will be keeping like this finger. That shows that this is not a C clamp technique. That is alpha. Many people have given C. I think C clamp technique answer. This is the answer. Hook technique is C. Hook technique we have not studied. This is the third question which you have not discussed in your exam. Like in the short term, or I don't know whether other faculty have discussed. So this technique actually is not a clamp CE technique. Okay. So from that, you should think about the maybe answer may be different. Okay.
Sir,
So what are
this we discussed in LMR, sir. LMR they discussed. No. Karthik sir discussed, sir. Image based questions and all.
Oh, very good. Karthik sir discuss. Okay, then
Yes, sir. The
see.
questions
I don't
are
know
discussed.
what they're answering.
They are
Student.
answering. They are answering. They are also telling sir discussed about this thing.
Very good, very good, very good, very good.
Karthik
Then
sir
it's
discussed
fine.
about this thing. They are also telling.
So Metier students, you are lucky. Last 6 months, those who studied WHO surgical list, one of the most repeated question in every AIIMS, as we given the slide. Those who joined recently for 35 days or 3 days and all, I don't know how people have written because there is preparation, especially for competitive exam. It is not to be done for 3 days, 4 days, or 5 days. Okay. So this is another important direct question which is in our slide. Okay, especially I kept in my slide. Before giving anesthesia, before giving skin infection, before patient leaving from the operation theater is a surgical. This is one option. Or what is the option? So what is the question there? Whether you remember the question?
Actually, this is up to the question, sir. Nothing they added in the question. According to WHO, before surgical check surgical safety checklist, what we have to do, like that they asked.
No, they were asking time out, time in, sign out.
No. That they didn't add up those options and also.
So answer is this.
This only, sir. Answer is.
So no B, C, D option. Whether anything they are giving. Discussion from student.
I'm waiting for student to answer, sir.
Yeah, let's see how they're answering.
Yes, sir. Before administration, before admission of the patient, like that one option was there, sir.
Okay. Before admission.
Before
Checklist only.
admission.
Okay. So then answer will be A only. Good. "50-year-old male, old male with history of chronic disease, prevents of emergency." Another one of the famous question which I usually tell the question how to manage the hyperkalemia. So, but no one has given you the message that we feel very happy after seeing the question paper. I don't know why. All the questions we are given very clearly in short-term batch when we are discussing the regular batch. Why you people are getting got a confusion? Old student, those who are attending the session, or you are very happy that so that you don't want to replay. Old student, those who attend the session for last 6 months or 35 days. Yes. Calcium gluconate, what was the option when you give in the first line treatment? Option C, old student, slow IVR, 20 to 30 minutes. What is the answer you given, Money? You are not given the answer.
I didn't add this question, sir. I added the question from somewhere. That's why I didn't add it, sir.
Answer actually when the potassium is going 6.8, answer will be B. Because we used to give bolus. What is the bolus? We used to give slowly 5 to 10 minutes. The option 4 to 6 hours won't come.
We give calcium gluconate only. We give, sir. Usually.
Yes, we give bolus 5 to 5 minutes slowly. I also given. Metier student, I think you have to be very clear in this.
But option some slightly differences will be there, sir. This is not the actual options.
I'm not discussing about the option, but what is the first line of management? The serum potassium is going more than 6 or 6.8. What we do, first we give calcium gluconate slowly. We'll take the 10 ml of syringe and we'll give slowly 5 to 10 minutes. Bolus we have given. Not a 4 to 6 hours won't come. Okay. So answer, if this may be the option, practically if you see, what was the option? We have to prevent the arrhythmias first, and then I'll go for insulin dextrose, then I'll go for nebulization Asthalin, right? So if this is the option, here option is wrong. Option is B. Answer is only calcium gluconate bolus. This is what I can tell. Whatever answers they've given from other area, I don't know exactly. But the clinical guidelines, when the serum potassium is going beyond 6 or 6.5, that shows that cardiac membrane, you have to stabilize first. Stabilize the cardiac membrane first. This maybe I repeated more than 100 times during my session. Cardiac membrane, we have to stabilize first. This is all questions related to my subject. So I will be very confident in this. Cardiac membrane should be stabilized first. When the potassium is going more than 6, I told you very clearly. When it is less than 6, I'll go for insulin dextrose and management. If it is more than 6 or 6.5, I'll go for cardiac membrane stabilization first by giving the bolus of calcium gluconate. Okay, so answer will be the B. So bolus, calcium gluconate, bolus are 20 minutes. That is also fine, no problem. 20 minutes, bolus are up to 20 minutes, no problem. First line of management is calcium gluconate, no soda bicarbonate. Soda bicarbonate will go after that only. It is not a direct management of calcium. So don't make you confusion, very clear. I think those who studied regular batch with me, you have to be very clear in this answer. Okay, if it is 20 to 30 minutes option also fine. It may be the right answers also. Both are there. Both are there. Mani, any remembrance there?
I think instead of 4 to 6 hours, it's around 20 to 30 minutes, sir. And another one, it's around slowly like that they added.
Slowly.
Yes, sir.
Bolus, what is that?
I'm not sure about it, sir.
No,
but
not
one
sure. Whether students, they may be giving the option 20 to 30 minutes. The answer is 20. CKD is there. Okay,
yes, sir.
CKD patient, no problem. CKD
Instead
patient
of
is not.
4 to 6 hours, it will be 20 to 30 minutes. It's
Then answer is 20 to 30 minutes. Please note down. Okay, answer is 20 to 30 minutes. Okay, so bolus are up to 20 to 30 minutes. Both are there. Bolus are in cha.
yes, sir. Two calcium gluconate, sir. Actually, one calcium gluconate, I'm not sure. Another one, it's around 20 to 30 minutes, sir.
Acha, okay. Bolus without timing. Okay. So if it is without timing, then if both options are there, option B is the right answer. Okay. So please note down, mind this. If both options are there, option B was there. If one option, calcium gluconate bolus was not there, then 20 to 30 minutes fine. Okay. Two options, students are giving two options are there. We give 10 ml, we load and we give slowly bolus. Okay. Bolus means 5 to 10, 5 minutes we can give. Okay. 6.8 is very high. If you make to give this around 30 minutes, also that is also problem because patient go for maybe cardiac arrest immediately. Potassium balance should be very clear. Membrane potential, cardiac membrane, we have to stabilize very fast. Okay. Even during CPR also we can give calcium gluconate, which I said. Okay. What is the most important position to keep the patient's head end of the bed immediately after craniotomy? Another most important question, which I repeated many frequently. I think this may be the good question because this is a craniotomy, not a ICP. So I think people have given the answer properly. This is given in our slide. Even my fundamental slide, I given specifically the craniotomy question. What may be the option? Craniotomy is 30 degree. Who said? Craniotomy is 45 to 60 degree. High CP only 30 to 45, semipolar. Answer, what is the answer? Craniotomy 30 or 60? B. What is the question? Money is there?
Yes, sir. This is the question. This is the question and this is of the option, sir.
Immediately after craniotomy, 30 degree Fowler. After status asthmatic craniotomy, we give Fowler. 60 degrees is the right answer. Either money you 30 kuduthirukla.
Yes, sir. I also given 30 only, sir.
30. No, actually semi-Fowler is, see, 30 degrees comes under your low Fowler. I told you very clearly in fundamental session, low Fowler is 15 to 30. Semi-Fowler is 30 to 45. Fowler we start from 45 to 60. High Fowler we give 60 to 90. Yes. 45 degree option. Is there is 45 degree also option?
45 degree, I think I didn't see, sir. Is any other people telling?
No. If it is
Only
the
one
ICP, I will tell. If it is ICP increase, the guideline shows 30 to 45. Craniotomy after that, because it may be supratendorium or infratendorium where the surgery is done. So little higher, more than 45 is a good site for the patient who can receive. Okay. Semi-fluoro non-operated site. Where are the option? I am not sure about your question, whether this is the question or any other option they've added.
Like immediately after surgery, which area we have to put like that they asked, and
Okay.
if not the word if not contraindicated, I'm not sure, but they added somewhat things, sir. Unless until any other like that they added, sir.
So
Without any
immediately
problem or
after
like that.
immediately after craniotomy and shoulder procedure, those who attended my fundamental positioning, surgical positioning slide, I had one slide immediately after craniotomy and your shoulder procedure. We have to give beach positioning, which I said, sitting in the beach, like beach chair positioning. Have you remember? Old student, have you remember? Beach chair positioning, which I said, sitting in the beach in the Fowler. Contraindicated is not there. Okay.
I also telling us that the contraindicated was not there, but instead of contraindicated, they added something.
After candidate, surgeon not advice regarding question means what question will give. Okay, question is like that.
Yes, sir. But actual question was like this only. But last one they added like if they didn't mention or somewhat word they added.
Okay, so Metier other YouTube channel they are giving 30, but I'll give 60 is the right answer. Okay. Fowler is 45, 60 is your right answers if the question is craniotomy. Okay. Initially, I give that one, which neurological, neurosurgical positioning. What is the neurosurgical positioning? Head end is followed like this, they will be giving. It is given the slide. Okay. So I am giving 60. Other people, if you are giving 30, I'm not sure, but 30, 60 is the right answer. Okay. Okay. One more choice you have. If it is 45 degree, then it is very important you have to take 45 degree. 30 degree is not a right answer. Okay, it's not comes under semi-Fowler because low Fowler is 15 to 30. Semi-Fowler is 30 to 45. So 30 won't be the answer, I'm sure. Okay, so if you want to decrease the ICP also, we give in 45 only, not 30 degree. 30 degree, the low Fowler position end will come. Okay. Which are the following is the most important thing associated with child suffering from Guillain-Barré syndrome? Okay. Direct question. It is given the slide and differentiation last LMR also we discussed. There is a two difference between GBS and other conditions, descending, ascending paralysis and leads to respiratory failure. Okay. Yes. So 70 kg persons have sustained 40 degree total surface area. According to Part-1 formula, how much fluid is required for the first 8 hours of resuscitation? Okay. When you can cross-check this question once again and give the proper answers if possible. Okay.
Okay, sir. I will check, sir.
This 10th one. So because there is one more craniotomy beach per position because initially we give this slowly we can decrease the positioning to 45 and 30 based on the drainage which they have after the craniotomy. Okay.
Yes, sir. I will check, sir. But students also telling question wise okay, but contraindicated word was not the like that they are telling, sir. And option wise also 90 degree, 30 degree, 60 degree, and flatter position like that they are telling. 45 degree was not there in option, sir.
Okay.
Like that only students.
Okay. Anyway, we can cross check the question once
yes,
again.
Sir, I will check and
please check the answers. Okay. So the direct questions, Burns formula, you've given, I think, 8 hours, 40 degree, 40%. 40 total body surface area, how much it comes? 70 kg. Okay, or weight is there, percentage is there, how much it comes total? What they're asking, according to Parkland formula, how much fluid is required for the first 8 hours? So what is the total, this 4 ml into total body surface area into age. So into 4 you calculate. So it comes around 4 into 7, it is 28, and 28 into 4, it is 9,600 ml. Right. So first 8 hours we divide. Sorry. Am I right or wrong? This is the question. 70 kg. 28.
Yes, question same, sir.
You are right. 5,600 right answer. 1,001, 200 is coming. Am I right? Okay. Divide by 2. 24 hours lalla. Okay, fine. So answer is 5,600. No, answer what you did.
Answer 5,600 only, sir. People are some people are telling not mentioned 6 hours, but I'm damn sure they added 6. Sorry, some people
8
are
hours.
telling not added 8 hours mentioned, but they added 8 hours, sir.
Nee, first see, if first 50% of fluid should be given the first 50.
Yes, sir. First 8 hours you have to give, sir.
After that we have to divide. So answer is 5,600 only.
Yes, sir. 5,600 only, sir. They added in question also they asked first
Yes,
8 hours
fine.
what we are giving like that they asked, sir.
Patient is prescribed for corticosteroid. Which of the following parameters should the nurse closely monitor during corticosteroid therapy? So corticosteroid therapy, immunosuppression. I said glucose monitoring we do. It will suppress the immune system, and then sign of infection. It's a direct question. Yeah, fine. No issues. Okay. So it's a direct question. So I think this also favor the direct question for Metier students. I think out of this, I missed 40 questions. Maybe 35 questions we crossed. Nearly 3 questions only from out of syllabus. Everything from the syllabus only. Especially, I given the clue for you in your short-term batch. Lumbar punctures contract. Once again, direct question. ICP. It's a direct question. Okay, ICP when it's increased causes brain herniation. We should not do the lumbar puncture. Before that lumbar puncture, we have to check IOP and ICP both because it causes brain herniation. Okay. A patient receiving infusion of morphine sulfate. Direct question once again. So antidote they're asking. Yes. Are you sure this is the priority nursing intervention? What is the question? Undergo respiratory depression. What is the priority nursing action?
Some scenario they given, sir. They asked a patient was in respiratory depression. Patient was in morphine sulfate, and what we have to do as a nurse, what we have to do like that they asked.
Can you complete the full question if possible? Because antidote, if it is naloxone, yes. Answer what you given.
They didn't add an antidote and all. They didn't ask, sir. Like, what is the first action? Like that.
Patient receiving infusion morphine undergo respiratory depression. What is the priority nursing intervention?
Like next action, like
no clue for oxygen, like any SpO2 or any respiratory distress or anything. Depression is fine. Patient go for Brady. Yes. So first line of intervention, if they're asking something different, priority nursing intervention always is a choice best management, that is naloxone. Okay, answer is naloxone.
Sir, PCA like that they mentioned, sir. Patient was in controlled anesthesia like that.
Patient control anesthesia. Oh, fine. Okay. Okay, patient was undergo PCA. Patient undergo sudden respiratory depression. Okay. Okay, so full sentence, if you go this such a question, morphine sulfate stop the option stop the mostly. What is the answer you given? See, step by step, if you go, patient is getting morphine sulfate. If the question is same, if undergoing respiratory depression, what you do? Directly you give naloxone, or first you will stop the infusion and inform the physician, then only we can go for the naloxone. Am I right? Money? This was the question.
Sir, one option that people telling like stop
Hmm.
PCA and observe, like that also an option, sir.
Stop PCA.
And observe.
This is what you are given here. A option. Stop the infusion, observe.
Yes, sir. Stop infusion and observe.
Then that may be the right answer. Okay. So priority nursing actions. So first, instead of directly going for medications, first you have to stop and inform the physician, and then they go for the naloxone. Okay. இதெல்லாம் வந்து make you complication தான், but simple answer only. Okay. So they're not asking direct antidote. Direct antidote, everyone knows. Step by step, if you are in the bedside, as I said, many scenario, if you are in the, think you are in the bedside, you are going to the bedside and morphine sulfate is going, patient suddenly had a respiratory depression. So what do you do? That will be the answer. You imagine whether you load naloxone and give directly. They are not asking antidote. So first step is to make the infusions stop and observe and inform the physician, and then only we can give the naloxone. Okay. Which are following mostly seen in the patients with anaphylactic reaction. There is a question confusion here. Primary anaphylactic reaction is always IgE. Only the risk factors, some of the risk factors shows IgA, but primary disturbance always from IgE. It's a direct question. I don't know why people have given, yesterday also they've given IgA. What is the rationale behind the IgA? I don't know. Okay, IgA is risk factors. It also comes under this one. But primary anaphylactic reaction occurs mostly from IgE only. Okay. See, initially not priority. Whatever you give, answer is stop the infusion and observe. Okay. Answer is stop the infusion and observe. Which are the following mostly seen in the patients with anaphylactic reaction? This is the question. Or which immunoglobulin deficiency they're asking? What is the question?
Like deficiency they asked, sir.
For deficiency A varanda, we are going for anaphylactic reaction. Have you checked this one? Deficiency A with IgA deficiency, we are going for anaphylactic reaction. It's a risk factors. IgA is a risk factors. Which antibody deficiency?
Sir, but IgA deficiency may cause this allergies kind of a thing, sir.
Yeah, I don't know exactly what was the answer question. This deficiency or most deficiency?
Deficiency like that they asked, sir. Which was
blood transfusion mentioned.
No, sir. That is another question, sir. It's kind of a simple question.
Some people are giving blood transfusion also mentioned.
No, sir. I think blood transfusion is another question, sir.
Another scenario. Okay.
Another scenario question, sir.
Acha. Okay. Okay. What do you answer, Mani? Deficiency the IgA or IgE you are given?
For deficiency like that, I thought and I went for IgA, sir.
But you check the answer whether IgA when come IgA is a risk factors, and IgE is a primary disturbance of your anaphylactic reaction.
But I checked, sir. On the time IgA deficiency patient may have a chance of this allergy.
That is what scenario. If the scenario baking, if I have the IgA deficiency, that is the scenario they're asking. IgA deficiency maybe they may be going for anaphylactic reaction, then it's fine because it comes under risk factors. IgA usually comes under risk factors. That means that deficiency only. Okay. So answer will be the IgA then. If it is deficiency, answer will be IgA. If the question is directly they are asking anaphylactic reaction, I think everyone knows this will be IgA. Okay. So compulsory if it is deficiency, that you can go for the IgA. Okay. Patient with rapid breathing, slurred speech and ABG showing respiratory alkalosis. What is the yes? So once again, respiratory alkalosis, paper bag mask, which I said, or partial rebreather mask, both we can do. Ask patient to breathe in paper. Very simple direct question. So there is no rational here. When I see this cardiomegaly X-ray, I was worried about when I took day before yesterday morning session. I was discussing about pneumothorax, pneumonia X-ray, and I was discussing about pleural effusion. And first X-ray when I showed, some people said cardiomegaly. Cardiomegaly, I said, when the heart is enlarged more, then it's a cardiomegaly. And that is a thing which also they've given here. So this is the two X-rays they've given. One is cardiomegaly, other is pneumothorax. Am I right?
Sir, they given question they asked what among this which is showing classical pneumothorax sign like that they given in the option they given four X-rays, sir. In four X-rays we have to choose one X-ray.
So what was the X-ray for? This is the X-ray or some other X-ray?
No, the two X-rays questions they asked, sir. This X-ray they asked, they given the X-ray, they asked which finding we can see in this X-ray. That is one question.
Okay. So if this is the X-ray, I need a full picture of X-ray because we have to check about this cartophrenic angle. This angle, you have to check it out, whether this is visible or not. Because we have to check about pericardial effusion also here. But the question is cardiomegaly X-ray. If you check cardiomegaly X-ray, we can check it out whether it's cardiomegaly X-ray. Answer is pneumothorax, another X-ray. This is not a pneumothorax X-ray because pneumothorax X-ray, pneumothorax X-ray will be, there is no vascular space. This will be blank. Okay, which I said day before yesterday. I think another question came in the pneumothorax. Okay. So what was the answer? You people have marked this one. 4 X-ray given. Option la.
Yes, sir. That is another separate question, sir.
If the angle is given, angle is clear. Last time I given, last day I given the clue, day before yesterday. When this angle is clear, then this may be the cardiomegaly. Or pericardial effusion is there. Pericardial effusion irincha. Option la.
No, sir. Actually, typical cardiomegaly X-ray only, sir.
Then it's fine. If cardiomegaly X-ray, enlargement of cardiomegaly you can have, because pericardial effusion la, you have to think pericardial effusion la cardiomegaly will be there. I think that is maybe the confusion we will be having. So answer is cardiomegaly. Okay. And one more X-ray which you have, that is your, what is that? Pneumothorax.
Yes, sir. Classical sign of pneumothorax like that they asked, and they given 4 X-rays. So they asked us to choose between the 4 X-ray.
Yes. Yeah. I think our message part 1 I've completed. So based on this, what I predicted, what I've seen the questions, like more than 70-80 questions, GK is very easy. Gokul, whether the GK question has been prepared psychiatry?
Sir, I have prepared, sir, but there is no options in that, sir.
Option answer is there, no? We can share.
Only, yes, sir.
At least they will get an idea.
Give me 2 minutes, sir.
So I'll discuss the expected cutoff and OBG I'll discuss, then we come for psychiatric. Madam is there in OBG also. So you see that based on this question papers, so what you feel like cutoff will be? Old student, those who study for 1 year or 6 months, what do you feel for general category and OBC and SC and ST? What is the cutoff you can expect? Just give your prediction, then I will tell. Yes. Give me your prediction, then I will tell. So part 2 questions I will discuss after 2 days. We are collecting the question proper answers. This is the part 1. And I have OBG question also. So with 10 questions, no idea. So general category, those who are in general, I think based on this question paper, which we can predict, like, nearly 1:5 times they will call, nearly 10,000 people they will be calling. I think vacancies around 2,100 something. So almost 10,000 plus candidate will be in the prelims list, usually 1:5. Okay, so question paper easy you are giving, but I will tell question paper for general, as you said. My predictions will be general will be 58 more. Okay, 58 and more, right? OBC will be 50 and more. SC will be 45 and more. So these all people will be in the list of 10,000 rank. So all 10,000 students, those who get selected for the prelims, maybe 1:8 or 1:5. 1:5, I think they will be selecting. 1:5, no? They've given anything in the advertisement 1:5?
I think so. 1:5, sir. I'll check that again. I'll check that, sir.
Okay. So what is the special thing? General category, as you said, 2 marks front and back it can come. Even 60 plus also you can consider. I started with 58, 60 plus, and OBC maybe you can get 52 plus. Approximately 2 or plus or minus you can add, and SC/ST 45 plus. Okay. It is not easy. It is not easy for, I will tell you people, Metier students, you feel this is easy, but since you have studied, but outsiders, we know that those who are not going for coaching is not possible, because this all the questions are very, some questions are very basics, 10 questions or 15 questions, but remaining all questions, unless until you have good clinical knowledge or something you studied, only you can write. Otherwise, those who have studied by themselves, it is not possible. So since you have studied for last 6 months and 1 year and 35 days, whatever you studied, so since we have discussed all the question in the slide, so you feel like easy. Okay. So, but the cutoff when it comes, this is the cutoff. Okay. Yes. So Metier students, I hope all 400 or 500 students, 400 500 students, you will be in the rank. 10,000 rank la kandipa will be there, because that question shows which whatever we prepared, mostly it is in like our favor only. Okay. It's not like completely it goes for out of syllabus. Then OBJ questions. Since can you share in mail? Let us have OBJ question.
Sir, I have already shared with the first mail, sir.
First mail.
Presentation.
Yeah. I've seen. Yeah. Just a minute. I'll check it. I'll change into OBG sessions. Let's see. 10 questions from OBG. Okay. So madam also joined with us. So Ranjini, you have to discuss.
Yeah. If I want,
I'll change the slide. You can discuss. Yeah.
Okay.
Okay.
So I'll discuss from my
Mhm.
So I'll start. Good evening, students. Now, this which drug causes this abnormality? This was the question. Actually, teratogen topic we had given, but the image we didn't give. So this is basically the condition of phocomelia, and phocomelia is caused by the antenatal provision of thalidomide. So if a pregnant woman is being administered thalidomide, which is usually given for this nausea vomiting, that can cause phocomelia, right?
So whether you can share, should I stop the share? You can share and explain if you have, you want to write something.
Yeah, I'll share my own slides.
Yeah. Okay, fine. Then I'll just stop. Yeah. You can share.
Wait. So students, is that visible? Like screen is visible, right? Screen is visible, right?
Yes, ma'am.
Yeah. So that was the answer. So thalidomide was there in the option. So that should have been the answer. Now coming on to this question, this was a straight question. So image-based questions, like we have many times discussed this. This is the Lancet maneuver. Lancet maneuver, like it is used in the breech delivery, like for the delivery of the extended arms. So I think all my students would have done it right, because we have discussed this image. And they had asked third question, see the action of this drug. They had asked the action, and here comes a doubt, like, see, some answers came to me like, somebody told me like, ma'am, the option was, it was given like alerting the ovulation. It was not exactly inhibiting ovulation. So in that case, the answer would be cervical mucus thickening. If supposing the option was inhibition of ovulation, then that would be the best answer, right? So actually, this Depo-Provera, that is your depomedroxyprogesterone acetate, DMPA injection, what is the action of this drug? That was the question. And basically, the main mechanism of action of this DMPA is your anovulation, or it inhibits your ovulation, right? And if that was there in the option, then that is the best answer. In case they have not mentioned anything about that anovulation, then the better answer would be a cervical mucus thickening, because this is a progestin-based injection, right? So this is the first best answer. If not, then you can go for the cervical mucus thickening. I don't know what was the options given in that. So based on the inputs that we have received, if inhibition of ovulation was there, that would be the best. Otherwise, go for cervical mucus thickening, right? So anyways, that is done. Now this image again, this image itself we discussed in the MCQs.
Some people are giving inhibit the ovulation was there.
Then yeah,
you can tell the answer. You can tell the question since
is
you have
there
written.
was there
Yes,
any
sir.
change in the word of this? Was that option manipulated? Instead of inhibition of ovulation, what was something else given? What was that fourth option, Mani?
I'm not sure, ma'am, about this OPG center.
Students, I don't know, like somebody.
Cervical mucus thickening is there, so I just ticked and came.
Now, supposing ovulation inhibition,
Inhibition of ovulation, I think, ma'am.
It was
not
there,
alter
then that.
Alter the ovulation, I think so. Inhibit the ovulation only, I think so.
Then it is the best answer, because that is the main mechanism of action of this any progesterone-based tablet or pillow, whatever it is, except your DM means Mirena, because Mirena will have a local action, right?
Both in same option they are telling.
Both in same option. So anyways, you got the answer, like you got the concept. So any options in the, and out of that, my answer is like anovulation is the best answer. If both the options were given in one single option, then that again is the best answer. If both inhibition of ovulation and cervical mucus thickening was there in one option, then that is the best answer, right? So accordingly.
Another thing, the second question, I think they didn't ask it, ma'am.
This one, yeah.
I think this
came. No. This came to me. Many students gave me this image.
I think instead of some other, I just sent it to you, ma'am.
Yeah. Prague is also there.
Prague
is also there. LoveSet was also there. Students has given me.
Okay.
Okay, so that was LoveSet, and this image again we discussed in the class. The same image we discussed. So again we had a confusion: marginal insertion of velamentous anus. So this is a clear-cut velamentous insertion of a placenta, right? Okay. Now where the cord is attached to the membranes first. So this is the velamentous insertion. Then this image again specifically I told in image-based question class la. Please, students, try to differentiate between Burns-Marshall and Prague, because both will look like same. Like the sense, if you immediately look at an image, you will think like this is Burns-Marshall, but this is not Burns-Marshall. This is a modified Prague maneuver where we use this in case of a dorso-posterior breach. You remember this? The same image, this is from your Williams text, and the same image I gave you in the class. How many of you did it right? So the students who attended the image-based question session, even in the class also I have discussed this. In the breech delivery theory also we have done this, right? So this is a modified Prague maneuver which we use in dorso-posterior. After coming head of the breech layer, we use this maneuver. This is not Burns-Marshall, okay? Now this image, like this is your Bandel's ring. We find this in obstructed labor whenever there is a CPD, right? When there is an obstructed labor layer, we find this Bandel's ring, and this also we gave in an image-based question. See, I gave you one session on whatever possible images from Datta, Sheila, Balakrishnan, Williams. I've compiled many images and I've given you in one session, and all those images have come, right? So this is a Bandel's ring. Now, dose of iron and folic acid in Anemia Mukta Bharat program. So I think this is the question. I do not know how was it framed, but the concept was that they had asked, like, what is the dose of iron and folic acid in case of...
In our slide, the question was there, ma'am.
Okay, so that is done. Yeah, so that is discussed. Okay. Now, pain with bleeding and uterus tender and firm at 37. Obviously, I've told you this in the classes. Any painful bleeding after 28, you have to think of abruptio. Painless, you have to think of placenta previa. So now this is a painful bleeding, so you'll go for abruptio placenta. Straight question, again discussed in the class. Now they had asked you like what is the drug and what is the indication where, or what is the purpose of that drug. So that have matched the following pattern that they'd asked. This was the input we received. Now oxytocin, augmentation or induction of labor. I don't know what was given there, but anyways, for the labor inducing purpose,
not augmentation, ma'am. Induction only.
Induction, okay. Misoprostol, you are very sure like we'll use it in cervical ripening. Magnesium sulfate for severe preeclampsia or eclampsia conversions, we'll use it. Antiepileptica, and methogen we use in after delivery, like postpartum PPH prevention. we can use it, or even in the management of PPH also we can use it for as a uterotonic, right? So I hope this was the options. So and this is the answer for that. Now coming on to second, match the following type. They had asked the maneuver where it is used. So second stage delivery, we use this Ridgen maneuver where we try to prevent the perineal tear, right? So modified Ridgen maneuver. And the breech Maurice Smelly technique, right? That malaflexion shoulder traction technique. We use that in the aftercoming head of the breech delivery. Shoulder dystocia, we use this Mac Roberts maneuver. That is your abduction, like hyperflexion of your thigh and abduction of the leg, right? And the placental delivery, Brand Andrew method or your controlled cord traction. So that is there in your placental delivery. So this was the another match the following type. Was that right, Mani? Like what was those? These were the options, right? I think this was the
Yes,
inputs
like,
given to me.
one or two I remember, ma'am.
Yeah, fine. So that was the inputs given to me. Next one is something on gestational trophoblastic disease, like a 20-year-old pregnant woman after suction and evacuation coming for follow-up. And that pathology, whatever histopathy you have taken here, that shows trophoblastic growth with no evidence of fetus. So that was a molar pregnancy, right? So that was a complete mole because they're telling like no evidence of fetus. So that is a hydatiform mole or a complete mole with vasculature and no metastasis. So there is no metastasis now. So how are you going to follow up her? Are you going to give HCG monitoring or combined chemotherapy, single chemotherapy or hysterectomy? See, in case you have a metastasis, in that only you have to think about either a combined chemo or single chemo or hysterectomy, right? Now, these options will come to you only in case if she's in the case of a metastasis, but they have clear cut, they have given no metastasis. So in that case, still we have to give a follow-up for 6 months. 6 months, what are you going to monitor for? We are going to monitor for HCG, right? Now, supposing they have given about some metastasis, in that case, either single chemo with methotrexate, illa e-Metier regime we have to give one rather, we'll decide upon the scoring, right? WHO scoring we have to follow and then we have to do. But clear-cutly, they have given us no metastasis, so we have to follow with HCG monitoring for 6 months, right? And this was another question. This where this is being used. This is a pap smear kit, right? The moment you see this IR spatula, you'll come to know this is a pap smear kit. So this also I had given in your image, right? So that's all for today. I think
what are the
OBG
questions? I think
questions.
OBG, Mani, is there any other question in OBG?
I think some students told me like some question was on late deceleration. I don't know what was that question.
Yes, ma'am. Late deceleration question they asked, ma'am.
Image or?
No, ma'am. Kind of they are telling the question. And they're asking what would happen, like.
What type of deceleration?
No, ma'am. They given the keyword I know only is that late deceleration.
So what was the priority action? Something like that.
No, what may be the cause? I think so. Like that they asked.
Okay.
Preterm delivery, like rupture of membrane, like that they asked, ma'am.
Okay. So any other questions like you remember?
No.
Okay. So most so far like OBG questions were answerable. Most of the questions have been covered, right? So I'll hand over to Rajkumar. You can take over.
Yeah.
Thank you.
Yeah, thank you so much. So I think most of those questions are we covered only. I think more than 60-70% questions. As I said, if you think about even psychiatric and I just share the screen. I think, sorry. Yes. So in psychiatric and some questions Sarah has given. So this was the question. Depression patient lost job last week. He's thinking about everything happened for something. Answer only I'm giving you because option we are not sure. So I'll going for the option directly and directly answer I'm going.
Another option was deletion of grandiosity was that, sir, for this question.
What was the answer?
And this is the answer, sir.
Yeah, this is the answer. Depression patient had fear of losing job and had a fear of that he did one mistake at work which is also resulting jobless. So Sarah has given a direct answers, catastrophic, whichever I don't know the option because option still we are collecting the option. So this is a memory based. So I'm giving the direct answer. Mani, you are right. Whether this is the right answers?
Yes, sir.
Yeah, very good.
Me and Sarah discussed, sir, actually.
Yeah, fine. So which are following the drug of OCD? It's a direct question. Every time comes in your exam. So this is also direct question. Schizophrenia patient not compliant with oral respiratory therapy. So what is the best management they're asking? So this also direct questions. I think psychiatrist Sarah has given you long-acting respirator. You are right, Mani. This is the right answers. You have checked with the question.
Yes, sir. Patient was not eating regularly, and patient was already in. But while in risperidone, patient symptoms are somewhat reducing. And what can we do? Like that, they asked us, sir.
Okay, fine.
Haloperidol SOS and long-acting risperidone.
Okay,
those
fine.
things and all they added, sir.
Early intervention before ECT. Another important question. Directly they put a question ECT. Keep the patients in nil peril oral for 6 to 8 hours before procedure. It's a direct question. Okay. Psychiatric also, I think, easy only. For Metier students, you are lucky that you got most of the questions, those who studied. MMC score 20. This also, sir, have discussed. It's a mild cognitive direct question. So option there is no 3 option. We are giving the direct answer from psychiatrics. Okay. What is the antidote of morphine overdose? 2 questions came in morphine. Or
No,
this
sir.
was a
No, sir. I think that question only they are mistakenly.
No. So that is not antidote. So
antidote like that they didn't ask.
No. Fine. So this was not the question then. Okay. Patient believes famous celebrity on TV is sending special image. Is another deletion of reference. Always this question is also easy question for you all. I think direct question. Simple question only they put up. What is the treatment of choice for autism? Once again, direct question. So applied behavior analysis. What is the direct option? I don't know what was the option. Okay. It's a direct question. Mani, you got it the answer for this?
Yes, sir. They're telling patient was not having this eye-to-eye contact. Patient want to play alone.
Okay,
and
fine.
Preferring their what they are eating, and if the routine was changed, they are disturbed. Like that, they are added in question. And here, cognitive behavior therapy, play therapy, those things and all they added, sir.
Okay, fine. So this is the right answer. This is about what we got in psychiatric, and your answer is Sundarban Mangrove Forest is West Bengal. Lifeline of Egypt is Nile. And who is the known of missile man? This all everyone knows. Basic GK. Abdul Kalam. And what's the national aquatic animal of India? Yes, Ganges River dolphin. So basic question. Basic romba easy today. This time GK is very easy. National flower lotus. Everyone knows. This is what we got questions from the student. Right. So most of the questions, I think 60 to 65, 70 questions we covered. As I said, you go and sleep happily, Metier students, those who studied. I hope, as I said, general category, you get the cutoff, which I said between 52 to 62. And OBC, you get around more than 50 because they will be selecting 1:5 ratio. Nearly 10,000 students will be there. They want to select based on the vacancies. How many vacancies for general? How many for OBC and how many for SC/ST, right? So this is the average cutoff which we give based on this question pattern. Okay. So based on this, you have to prepare for your mains. So another waiting exam on May 4. So start preparation, because those who have the confidence, don't waste your time, because April 20 or 21st, the result will come. Okay, mostly. So another 1 week. So see your content, revise the content, keep it ready, right? So we'll go for MCQ batch, especially. This time we are not I'm just going with the quick LMR and MCQ batch. Separately MCQ test series batch, because we know mains is 160 questions. We have to work hardly because you are in the half of the area you reached in the prelims. If you have cleared mains only, you are going to get a job. Okay. So we are preparing for May 2. Fine. Sorry. We are preparing for MCQs, mingle together all type of MCQs in 10 test series. Let us see how we also need a time for next 4 or 5 days. So we'll bring the best question. As I said, out of 100 questions, I'm sure guarantee that 70 questions are from directly from Metier faculty content, whatever we teach directly. Even I have the proof. Ma'am has given the proof, and Sir also given the content. Okay, so those who studied for recently last 6 months or 35 days, they know the importance of the content. So always content is always important. This 1 week, those who are having confidence, prepare the content, keep it ready. So revise the content, don't sleep. Today, okay, yesterday you had a rest, And today start putting the schedule and start revising the content. Okay, so MCQ we can practice after 20. So we'll working for that. We bring the new MCQs based on the current up-to-date pattern. Okay. So thank you so much. Go and sleep and enjoy the days for 1 or 2 days and start preparing. Those who are having good confidence level, yes. What is that? Yes.
Sir, the
Preparation
five
for
teams,
this stage
you have
2. Yes. 1:5 ratio they are selecting. 5 times total seats, maybe 2,100 total seats. Now you almost 10,500 candidates they will be selecting for the mains. You are going to compete stage 2 exam for the 10,500 candidate only. Now you challenge with 1 lakh student. Now we are going to those who got good rank and those who are in the list. It doesn't matter if you are 900 rank or if you are 7,000, if you are 9,000, if you are 10th rank, doesn't matter in prelims. Prelims if you are selected in the list, that is enough. Now you have to work hard for the mains. Okay, mains is completely different. Those who are aware of this, they know section A, B, C, D is a different pattern and 160 questions are there. Okay, time management is very important. Maximum test series you have to practice, then only you can achieve in the mains. Okay, so thank you all. And as I said, the expected cutoff averagely plus or minus 2 front and back. For this, you can decide and you can go ahead. Okay, so mains pattern is some people are asking 160 MCQs in 160 marks, 4 alternative each questions related to subject. We'll have the session. Okay, the question paper is divided into 4 sections, not a 5 section. There is no GK and aptitude. Those who are attending first time, it is directly 1 is to 40 question, 40 section A, 40 section B, 40 section C, and section 4 40. Each section carries 45 marks. Sorry, each section carries 45 minutes. The examination will be each section is 45 minutes plus 45 minutes plus 45 minutes plus 45 minutes. Total 180 minutes. And each section carries 40 question, 40 question, 40 question, 40 question. And I'm sure it will be little tough for you people because you cross this much, you have to work hard because concentrating 1.5 hour exam is different. Concentrating 3 hours exam is different now. Okay, your concentration should be very clear along with your content knowledge. So now you have crossed the limit. Now those who are good did well. I hope you get a good rank. Rank doesn't matter in prelims. If you are in the list, if you hope you are in the list, so you start preparation now itself. Don't waste the time. Okay. So thank you all. Thank you for this. So access free it is not possible. Okay. Already we have given only for V14 batch, the access will be there because they have joined in January. Okay. So access, we are working for the some of the limited thing. We'll work on that. We'll give you. Okay. So thank you all. Okay. Thank you all. Thank you for your response and well and good that you people have did well for exam. Okay. Thank you all.
Thank you, sir. I'll end the session, sir.
Yeah, fine.